This is a tutorial on MyDispense. MyDispense is a web-based application that College of Pharmacy at King Khalid University have an access to through collaborations with Monash University. It used to simulate dispensing and counseling on both prescription and over-the-counter medication in community setting and hospital setting. MyDispense applications is utilized in Introductory Pharmacy Practice Experience 1, CPH 611, and Introductory Pharmacy Practice Experience 2, CPH 612. As a student, you will work on hypothetical scenarios that are very similar to these you might see in real life to help you gain confidence and acquire the necessary skills before start field training. To log in to MyDispense, go to mydispense.kku.edu.sa. This link will be posted in Blackboard for easy access as well. Click Log In, and it will take you to the KKU Login page. Use your university login information, university ID, and password, and click Log In. Once you log in, you will see the course you enrolled in, either CPH 611 or CPH 612. You will also find practice exercise and trial unit that were created for practice purposes only, and they are not graded and multiple attempts are allowed. However, all exercises listed under CPH 611 or CPH 612 will be graded, and you must complete the exercise on one attempt. You can click on View Tutorial to see all exercises listed under each unit. For practice purposes, click on Practice Exercise Unit. For now, I have only one folder, Dispensing Exercise. In Dispensing folder, you will see all the activities assigned to you to complete, and in the right side, you will see how many activities you have completed. I listed some tips that you can use as a guide to help you complete the exercise successfully. Make sure to read them before you begin the activity. If you click in the unit, it will take you to the previous screen. But if you are ready to start the exercise, click on Dispensing Exercise. Once you begin the exercise, a small window with a brief introductions will pop up. In this tutorial, we have a patient comes to the pharmacy with a new prescription to be filled. Then you click OK. If you miss reading the message in the introduction window, you can go back to it by clicking on the icon on the top of your screen. You will also see, you'll be able to see the exercise date and the time elapsed. To be able to track the time for timed exercise. Make sure to ask your course instructor for if the exercise is timed to be able to manage your time efficiently. Your username will show on the top right corner as well. In the left bottom of the screen, you will see two icons, one for label and the other one for medications. For now, you will see them 0 because we haven't finished preparing any of them yet. Also in the bottom of the screen, there are icons for prescription, dispense screen, bench top, prescriber fact-finding, patient communication, references, and professional notes. You can hover over the resembled pictures for easy access. For example, if you want to view prescription, you can click on the prescription icon on the bottom of the screen, or you can click on the prescription itself in front of the patient. Same thing for dispense screen, bench top, prescriber fact finding, patient communication, and reference. If additional document is attached, you will be able to find it by clicking on the attachment icon on the center of the screen, or through patient communication as an attachment. Here I have a lab work that listed for you for the exercise. The arrow on the right bottom of the screen will take you to the back shelf where you can see prescription medication, or it can take you to the front shelf where you can find OTC medication. To go to different areas within the pharmacy, use the arrows. Do not use X, because X will exit the exercise even if it's not completed. Okay, let's start working on the exercise. Let's look at the prescription. In the top left, you will see the prescriber information, patient name, patient address, and age are listed as well. Date to prescribe must be current, not too old, or prescription written in future. In the center, you will see the information about the prescribed medication. In this case, we have azithromycin 250 milligram tablet. Day 1, 500 milligram. Day 2, 250 milligram twice daily for 3 days. Quantity, 5 tablet. Repeat means the refill. How many times do you want the patient to come back and refill the prescription? In this case, it's 0. Do not substitute means give the drug as it's written, not in a different brand name. After we make sure that the prescription is legit, make sure that the medication is safe and appropriate for the patient. When we look at the directions, we know that azithromycin is usually given once daily, so we need to confirm from the prescriber before we change the frequency, just to make sure that we're giving the appropriate medications for the patient safely. To reach the prescriber and ask about the frequency, you just minimize the prescription. Go to prescriber fact finding by either clicking on the phone or clicking on the icon for prescriber fact finding. You have to select the right prescriber in your prescription. In this case, we have Dr. Manal Farid, so we have to look for Dr. Manal Farid in the prescriber list. Here's our prescriber. Hi, what do you want to know? We're going to go with continue, and we will ask about dosing query because our question is about the frequency. Make sure to select the right question. You cannot select all, because when you select irrelevant information, that will result in deduction of your point. So our queries is about frequency, so we're going to go with dosing query. Then the prescriber respond, yes, I probably wrote the frequency as twice daily by mistake. Please change it to once daily. Thank you. Now we confirm the change of the frequency changed to once daily from the prescriber. Okay, let's minimize the prescriber. screen and go back to the prescription, we can write on the prescriptions any modifications we made by clicking on the toggle endorsement panel on the top right corner. Then you will select what items within the prescription need to be changed. In our case is the frequency. So we're going to look for the frequency. Okay, we're going to go with direction. Then we will change it as once daily. So I'm going to keep the day 1 as it is. Then day 2 will be 250 milligram once daily for 3 days. Since we change the directions, we want to make sure that the quantity is appropriate based on the frequency change. I'm just going to drag this here. Okay. Okay, then the quantity is appropriate because the patient is taking 2 tablets on day 1, then 1 tablet daily for 3 days. So that's a total of 5 tablets. So the quantity is correct. The only change we made on the direction. Once we modify the prescription, then we can just minimize it and write it in our professional note in the on the note icons on the bottom of the screen. I'm going to write call the prescriber and change the frequency of azithro mycin to once daily. Once we're done with our note, then we can just minimize it. Now it's the time to enter the medication in the system. To enter the medications, we need to click on the dispense screen or go with the icon in the bottom of the screen. And for easy access to the prescription and to be able to copy information from the prescription to the label, we're gonna just lock the prescription so it won't move. Move it to the side and go in the dispense screen. In the dispense screen, you're gonna enter the patient name. We have Khalid Ahmed. We can just write the first name and hit enter. Then all the patients with name Khalid will come up. Make sure to select the right patient. Same address, same age. Once we select the patient, then we have to look for dispense history. This is all the medication that patient is taking. We can look for the date prescribed, and if we enter, we can see more information on the medication. When it's prescribed, how many refill does the patient have? Same with the second medication. Also the direction written in both Arabic and English. We can also see if the patient have any past medical history here. So here we have that the patient has a medical history of hypertension and diabetes, which makes sense because the patient the patient is on glucophage, which is metformin for diabetes, and lisinopril, which is a blood pressure medication. If there is no drug duplications or drug-drug interactions or any concern with the patient past medical history or past medical or current medication list, then we're gonna start entering the medication. So start with the script date. Script date is written here. So it's September 9. We're going to enter the prescriber name. We have here the prescriber Manal Farid. So that's our prescriber. Drug name, azithromycin. If we hit enter, we'll get a list of all azithromycin formulation. Pay attention to the dosage form because azithromycin is available in tablet and also capsule dosage form and also in suspension dosage form. So make sure to select the correct dosage form and correct strength. So our strength in the prescription is 250 and it's tablet. So this is our first one. In the directions, we're gonna write the directions. Make sure to write a verb followed by route of administration, followed by a quantity, followed by route of administration, in the directions, make sure to write the directions in both languages, Arabic and English. So here's our directions. It must contain a verb, then a quantity, then route of administration, then frequency, and duration. So we have take 2 tablets by mouth on the first day because in the prescription, day 1, 500 milligram, which is 2 tablets of the 250 milligram. Then 1 tablet daily for the following 3 days. In Arabic, we'll write خذ حبتين بالفم في اليوم الأول ومن ثم حبة واحدة يوميا لمدة 3 أيام. In the refills, here we have the repeat 0, so there's no refills, so the patient cannot bring the same prescriptions for refilling. In the quantity, we need 5 tablets. Pharmacist initial, it will be the first letter of your first name and the first letter of your last name. Okay, so this is how the label gonna look like. The direction written in both languages. If you're okay with the label, then you can just click on print label. Now that we print the label, you will see in the bottom left of the screen that the number of the labels we have is 1. We still have 0 for medication because we did not prepare the medication yet. But we have 1 label, 0 medication. We're going to minimize this window. and start preparing the medication. Since the medication is for azithromycin, which is a prescription medication, so we're going to go to the right arrow and we're going to look for the prescription for the azithromycin. Based on the prescribed medications, you will go with prescription shelf or fridge item or safe. Fridge item for any medication that need to be stored in the fridge. Safe for controlled and narcotic medication. Okay, since azithromycin is a prescription medication that's stored on the shelf, we're going to go to azithromycin. All the medications is placed in the shelf in alphabetical order. So we're going to go with AZ, azithromycin. So this is our medication. Let's make sure it's correct. It's azithromycin, same medication. It's tablet, same dosage form, and the strength is 250. Same dose. It is same prescribed dose. So we're gonna go with add. Okay, this bottle has 30 tablets, but we need only 5 tablets. So we're going to go with add, then we're going to count. Count 5 tablets. This icon if you want to count one by one, and this is if you want to count 5 by 5. So let's go with 5. So this is my 5. Then I'm gonna click on fill bottle. Are you sure you want to add counted bills into the bottle? I'll put fill bottle. Now I have my medication. So I have one label and one medication. Let's minimize the screen and start working on preparing or handing the medication to the patient. So if you click on the bench top or the basket, it has the medication and the label, or you can click on the icon on the bottom of the screen to go to the same screen. So I'm going to click on my medication. Then I'm going to click on the scanner and click on the medication. Then it shows that the scanned item is correct. Then I click on the label and place it with the medication. And if the patient need any ancillary label, we can select from those, like take on empty stomach, or do not show or crush, or use it with plenty of water. All these things. Okay, now we have our medication and label ready. Let's start handing the medication to the patient. So we're going to click on the on the patient. We can look for lab work and see if there is anything that maybe contraindicate dispensing azithromycin to the patient. We can also ask the patient about additional information. We can ask the patient about age. We can ask about allergies. Make sure to ask only relevant question. I cannot ask about breastfeeding because patient is a male. If I ask irrelevant questions, that will result in deduction of points. I might ask other medications if the patient taking other medication. So here's my questions and here's patient answer. And if I scroll down, I can see more of my question I ask and patient answer. So we ask about the allergies and patient says he had allergy to penicillin, other medications, lisinopril and metformin, and we already saw those two medications in the dispensing history. We can look for other questions that we can ask. We cannot ask about pregnancy because the patient is male. Purpose of the medications, we can ask if the patient knows, because if he doesn't know, we can counsel the patient on the purpose of the medication. What is the medication used for? So here's patient said, I'm not sure, he will have to ask my doctor. We can ask also about smoking status and weight. Very important to only ask relevant question. I can also ask if the patient have any question for me. So I asked the patient, do you have any question? And he replied, are my medication interacting with each other? So I have to put here my answer. Then reply. We can also add counseling point for the patient. It is very important and it's graded. I can counsel the patient on the purpose of the medication, how to use the medications. So here's some counseling point that I put. This medication is used to treat bacterial infection. Very important to take it at the same time every day for 4 days. Complete the course of antibiotic and do not stop taking azithromycin even if you feel better. So I can counsel the patient on those. Then I'll make the decision to hand over the medication or to not dispense. If I find any drug-drug interactions and I didn't get an answer from the prescriber, then I can choose do not dispense. If everything is safe and appropriate based on the patient's specific factor, then I can select handover. Then finish. Then I'll get the message, exercise complete. This exercise has been completed. Your progress has been recorded. Then I go with exit. Now that you complete the exercise, you can look at the feedback and see your answer compared to the ideal answer. And you can see the feedback by clicking on the same exercise after submitting it. This is your patient, and here's a summary, and here's the outcome. Well done, dispensing the prescription was the correct decision. Anything written in green means it's correct, anything in red, incorrect. Also here, your label compared to the correct label. All the information you entered in green means correct compared to the ideal answer. Also the medication bottle, the quantity, the correct quantity is 5. And the medication name, the selected medication name. And you can scroll down to all other items to check your answer versus the correct answer. You can also reset the exercise to be able to do a multiple attempt for practice purposes. And if you have any questions on this tutorials on how to process a dispensing exercise, make sure to contact your course instructor about any questions you might have.